Welcome to the American Academy of Optometry podcast series brought to you by the American Academy of Optometry Foundation. Today's episode, Clinical Outcomes of a Randomized Trial with Contact Lenses for Astigmatic Myopia Management. Your host is Dave Kading. Your topical editor is Andrew Pucker, and your topical expert is Anna Tichenor. Now, on with the show.
Thank you for joining us for the FAAO Clinical Podcast Series. My name is Dave Kading, and I practice in Seattle, Washington, and I'm delighted to be joined by Dr. Anna Tichenor, and she's going to be sharing a little bit with us about some clinical outcomes of a randomized trial of contact lenses for astigmatic myopia management. But first, Dr. Tichenor, tell us just a little about you.
Yeah, sure. Thanks, Dave. So I am an assistant professor at Indiana University School of Optometry, and I'm also director of the dry eye clinic there. So I see and manage patients with ocular surface disease. I instruct and supervise students, and I also do some lecturing. And in my spare time, I also do some research, both clinical and translational research.
Awesome. Okay, so clinical outcomes of a randomized trial with contact lenses for astigmatic myopia management. What is this about?
Yeah, so I think the goal that the authors are trying to kind of have with this paper is to kind of start to sort of highlight that we have really limited options right now for myopia control for our young patients who have moderate to high astigmatism. So their goal was to really kind of look at visual outcomes, so both objective and subjective measures of wearing toric ortho-K lenses compared to a toric soft multifocal in a cohort of astigmatic myopic adults. Essentially just to kind of compare and see what's the effect on daily activities, how's the visual performance of these lenses in this patient type.
Yeah. So who all was included in this? Is it just children or
Yeah.
what?
Yeah. So they actually, interestingly, they used adults. So I think we can all agree adults will probably be able to describe, their daily activities and how the visual performance of the lens can affect those activities that they have on a daily basis a bit more critically and probably with a little bit more words than a child can. So they did use adults in this study to look at that. And these were non-presbyopic adults. They were myopes up to -5 diopters, and they had to have between 1.25 and 350 diopters of still in their correction. And they were soft contact lens wearers currently.
Okay. And we get really curious about this when we get into myopia management and how our patients are functioning, but maybe not on an everyday basis. But what about the high contrast, low contrast, glare acuity? Is there a lens type that performed better?
Yeah. So from the results of this study, what we found is that actually the soft toric multifocal contact lenses performed much better on these objective measures of acuity and the glare and high and low contrast acuities when they compared it to those that had worn the ortho-K lenses. So the soft torics are actually performing pretty well here. The one little caveat, which was interesting in this study, though, is that when the subjects themselves had to kind of compare or report on their vision, they actually said that the ortho-K lenses performed a bit better visually.
So I want to make sure I clarify that. So the patient's high contrast, low contrast, and glare acuity was better, but the patients thought that it was better with ortho-K, or that they just would rather wear ortho-K?
Yeah, I think so. The patients said that their vision was better with the ortho-K lenses, and we can kind of maybe think about that, like the stability of the blur. So maybe the soft toric lenses, when they're wearing them during the day with blinking, maybe there's some slight changes. So these were adults, so they're probably pretty critical of their vision. So maybe they said that they like the ortho-K because while there may be some blur, it's kind of a stable blur throughout the day after wearing the ortho-K lenses at night, compared to those soft multifocal toric lenses that they're wearing constantly.
Yeah. Yeah. So they tried soft lenses for 10 days, and then they tried ortho-K for 10 days. They had a washout of about 2 weeks, and then or vice versa. And, what about refinement? When I order a soft toric multifocal, I kind of start off by ordering it based on their prescription. And with orthokeratology, toricity corneas tend to be a little bit trickier. What was the trial period? Did they remake lenses a bunch of times if they needed it, or how did that work out?
Yeah, so the others also wanted to kind of see, just they wanted just to fit empirically. So they took topography measurements and they just, based on the manufacturer's instructions, ordered ortho-K lenses based on that. And they didn't make any remakes at all. So, you know, um, these were just sort of empirically fit to kind of see, how successful just fitting based on, the first lens we put on the eye, seeing how the visual performance would be with that.
Okay. So this really didn't have anything to do with making modifications to the lens. Do you think that maybe affected some of those low and high contrast and glare acuities that the Ortho-K didn't perform as well?
Yeah, I think that's something that we have to keep in mind when we're reading this paper, because not only could remakes have possibly improved some of those objective measures that were low for the ortho-K lenses, um, it also limited the number of subjects. So it went down to only 17 subjects who had, good vision that they allowed to continue throughout the study. So this was really, a very small cohort, only 17 subjects that we're kind of drawing these conclusions from.
Yeah. Orthokeratology is not a method that is thought of first line for patients with toricity. Um, anything from this about how successful it was with the first lens? Because that's all they tried. So as a percentage, I think you said 17. Like, what about, do you remember what that percentage was? I think I might have read, correct me if I'm wrong, about 63% with
Yeah.
first fit success. And on the toric multifocal, according to the parameters they said, is 95%. So you think about that, like 63% with first lens success, that's way more successful than I used to be with soft toric lenses. I mean, it always used to take me 2 or 3 to get where I needed to be. That's still pretty high.
Yeah, I think.
But to your point, if they had been able to maybe make some modifications, maybe that glare, shadow, halos would have been a little bit better. Yeah, so that's a really interesting component of this. Any closing thoughts, your takeaway? How is this going to affect some things for the clinic for you?
Yeah, I think the important thing, again, is this paper really highlighted that we need to have some options for um, myopia management with patients who have astigmatism. So we need to be able to use toric contact lenses to be able to implement myopia control in those patients because they're out there. I have a high high amount of astigmatism, so I think that option definitely needs to be out there and created for
Yeah.
patients. It's definitely needed for sure.
Yeah. Well, in this being an adult population, it tends to be that children are, in my clinical experience, they seem to be less affected by that glare, shadow, halos, right? We oftentimes make smaller optic zones or treatment zones for those patients. They tend to not be as affected. So they may actually do as well or, better than in the study than the ortho-K patients. A study would be great to find out. But this paper really does show us that astigmatic patients really are needing something more, and this really does point out for myopia management, these are great options for them. So fantastic. Thank you for your review. Yeah,
Thank you.
absolutely. Yeah, and thank you for joining us for the AAOF's clinical podcast series. Uh, Please do us a favor and like the podcast, subscribe, and so you can get other updates of when we bring out some clinical podcasts. And please do share this with a friend so we can share that information with other people who are interested in this information. Thank you.